Happening right now, health officials are tracking a COVID-19 summer surge across the country. Here in Florida, the CDC reports cases remain very high.
Turn things over to Larissa Scott. Larissa, you talked to doctors about what this means for kids now that they're back in school. Let's talk about that.
Well, James, some doctors believe this year's summer surge could be one of the largest for the season since the onset of the pandemic, which means the virus will spread in schools.
We've seen the numbers go positive over the last couple weeks. They've really kind of skyrocketed beyond what we've seen in the last year or so.
Experts believe this current spike is due to Omicron's FLiRT variants. They continue to make up the majority of cases and are highly contagious.
We've been seeing more and more COVID being detected in wastewater. And so why wastewater is important is because nobody has to test. So we know people aren't testing, but the wastewater doesn't lie.
Officials say this current COVID-19 wave has surged in all regions of the United States. And according to the CDC's wastewater surveillance in the South, COVID activity is nearing what it was in January.
We have seen an increased number of patients coming in.
What doctors say is different this year is that this spike happened a little later in the summer than past years. So now there's a bigger risk for spread in schools before the updated fall vaccine is available.
These viruses do like to transmit in kids in schools. So I anticipate we're going to see more cases come in. And this wave will probably be prolonged because kids are getting back in school.
The good news is doctors say many younger children will probably be asymptomatic or have mild symptoms, but some kids will still get sick.
What to watch for parents, I would say the really great indicator is that sore throat. Well, that's one of the key first signs and symptoms we're seeing with everybody is the sore throat.
Kids that get COVID usually do well with it, but they can be pretty sick. They can have high fever, cough, sore throat, and a lot of misery associated with that. So we're seeing children come into central care, urgent cares with these fevers. They look miserable. So it's not just a simple cold.
If your child develops any COVID symptoms in the coming weeks, doctors encourage you to test them.
It's good to know, for at least historically in their medical records may show, at one time, this is a kid that did have COVID. We do see some long COVID in kids.
And as a reminder, keep kids home if they're sick to minimize that spread in schools. And doctors say if they do have COVID, make sure they stay hydrated. Dia.